Today, I spoke with Newtown Police Chief Tom Synan about fighting those overdose deaths. He told me it's like that old story of all the starfish that wash up on the shore, and a young boy tries to throw them back one at a time. In the story, an adult sees the tough effort.
So he walks up to the young man and says, "Young man, you'll never save them all. You're wasting your time." So he picks up a starfish and he throws it in the ocean. He says, "Well, at least I saved that one." That's what we're doing.
One at a time, which Synan says isn't working. He got emotional about it, as you could see. In our interview, he told me we have to think about overhauling the framework of how we as a society tackle mental illness and addiction so we can help the masses. As a member of law enforcement in the Hamilton County Addiction Response Coalition, he sees a lot. It's why we took our questions to him about the 93,331 lives lost in 2020. If we had not had the pandemic, would that number be as high as it is?
It wouldn't necessarily be that high, but I believe it would still have risen. I think we as a society have to change how we view and deal with addiction. We have to humanize the issue and see people that are struggling and suffering, and not just see the individual, but see the entire family.
You take one person in that 93,000 figure. That one person has lots of other people who are affected, right?
The mother, father, brother, sister, son, or daughter who is impacted just as much as the person that is dealing with the addiction themselves. So we can never discount the one, because it's never just one, it's many. My opinion is I think we as society are some of the biggest enablers of addiction. We blame the person who's addicted and afflicted when we should be looking at ourselves and take an honest look at ourselves and blame ourselves for the conditions we allow people to be in.
What I hear you saying is that it's the structure of how we handle addiction that's actually fueling addiction.
It truly is a mental medical health condition. It is not something we should be punishing. It is not a sin. It is not a moral failing. What COVID did, in my opinion, was it exacerbated every single problem we have with addiction. It bubbled it up to the surface. We still criminalize it, which in my opinion, it is our criminalization of addiction itself. I'm not talking about drug trafficking. I'm talking about addiction itself, whether it is alcohol, opiates, methamphetamine, cocaine, whatever it is. It's our criminalization that continues, in my opinion, to be the biggest enabler of addiction, because it doesn't allow us to move on and treat it as the mental medical health condition it is. Addiction, the substance changes the chemical in the person. It changes their brain waves. We don't recognize that. And when it comes to treating addiction, Synan believes we need to create a concrete framework within the medical system to improve what he calls the existing piecemeal response. He believes a strong framework would allow for quality control protocols you could extend across the system at multiple levels, including things like insurance coverage, where critics say there are definitely gaps. Finally, Synan says as a society, we need to talk about how to handle stress, grief, depression, and anxiety from a young age on, so people do not turn to numbing substances.